Welcome to the Science to People podcast, where we turn cutting-edge health and science insights into information that's discoverable, understandable, and actionable. I'm your host, Brinley Murphy-Reuter. Today's guest is Dr. Amelia Burke-Garcia. Dr. Garcia is a seasoned public health professional with 20 years of experience designing and implementing strategies that leverage the science of communication to influence behavior. She is the author of 2 books on health communication, has been highlighted by the U.S. Surgeon General in honor of Women's History Month, and has been named to the VerywellHealth.com's list of 10 modern female innovators taking up healthcare. But what does all of her work really mean for the rest of us? How does someone with this background help everyday people cut through the noise of confusing health headlines and take action? Well, let's find out. Dr. Burke-Garcia, welcome to the Science to People podcast. Amelia.
Friendly. How are you?
Dr. Burke-Garcia, thank you so much for joining us. Yeah, really excited to have you. We're friends now. We met because we both spoke on a webinar for the Public Health Communications Collaborative a couple of months ago, and we just can't seem to get enough of each other. We keep chatting.
It's true.
We keep finding different ways to collaborate if we can. And now I'm so excited to have you here today.
Excited that you've started a podcast. Let's just take a hot beat on that one, right? Congratulations.
Thank you. The podcast nobody asked for. Well, I'm really excited to chat with you today. So we're going to start the conversation like we start all of them, which is with your coffee shop line. Let's just say we are stuck in an annoyingly long line at a coffee shop. And I turn around because I'm a chatty Cathy and hey, what do you do? What are you doing here? What do you do? What are you doing today? What are you going to work to do today? What would you say?
So I loved this question when you sent it over. And I was thinking immediately, well, if I'm in the coffee shop line, I'm not sure that I'm actually going to give you a very coherent answer because I probably need that caffeine, right? But if I had myself together that morning and this was my top off caffeine, I would say I'm a health communicator. And I've been working at the intersection of digital spaces and health behavior change for over 20 years.
Damn. That's what I would say.
Would that prompt you to ask me more questions? Is that interesting enough?
It sure would. Well, I think that's really fascinating because you've spent your career, communicating or learning and teaching how to effectively communicate about really complicated topics, right? Mental health, vaccines, aka immunization, right? But at a large scale. So I'm curious kind of how that large scale has evolved and how you keep the information that you believe the public needs to know about from being buried in all of the kind of noise or chatter, especially online.
Yeah. It's a really good question. I think there's a couple of sort of things I want to touch on as it relates to answering your question. I think the first very sort of practical, maybe more operational in nature kind of response is one, we have to do a better job of innovative and interesting formats and communication approaches. And what that means is video content, but not just talking head video content, right? Honest, scripted, transparent video content that kind of gives the viewer insight into whatever topic it is you're talking about, but not in a very canned way, but in a very sort of authentic, interesting way. We have to make our topics and our information interesting to people. They want to watch it. They want to watch more. I also think it matters in terms of, being everywhere. I think that that's a big statement and it's hard in health communication and public health. We often don't have the resources, the people necessary to do everything that we need to do, right? But I think the challenge for us in communication, in health communications, is that we are living in a diffuse communications environment. Yes, people get information through traditional television, through radio, through still, different types of print publications. But people are also getting information in very niche channels, podcasts, online communities, YouTube, video, like sort of verticals of content streams that they are subscribing to or that they go and they follow, and that's what they consume. And I think the challenge for us as health communicators in this environment is it's not enough to have a presence on sort of the big platforms. We actually need to be in all of those niche conversations. And I think that that gets to maybe the third prong here, which is we need to work with all different types of messengers. And I think that there's a challenge here because in public health, in health communication, I think we think of certain types of messengers as being more credible than others. And I'm not sure we always get it right. It's not to say that the health communicators or the health professionals or the medical professionals are not credible. They are credible. We see this a lot in survey research that doctors, healthcare providers are usually, if not the first, in the top, like messenger types. I would encourage us to think broadly about what it means when we hear that a provider is trustworthy, because providers are not a monolith, just like so many other things are not a monolith. Providers come in all different shapes and sizes, and we know that a lot of providers are faced with a lot of questions from their patients. And oftentimes providers are trying to make a call, like a judgment call between administering a health intervention, right? Whatever that is, a recommendation, a vaccine or whatever, and keeping that person coming back to their doctor's office, to their point of care. And if that means not administering a particular health intervention in that moment, some doctors will choose not to do so. It doesn't mean that they're bad doctors or bad people or they're not following guidelines. It's that they're actually trying to maintain trust and serve that patient the best that they can. Likewise, we know that people listen to peers. And I would say there's a similar thing going on here, right? That like we listen to other people who have been in the trenches, who are in our situation, who have gone through and made decisions, or who have done the research and made decisions and are struggling or have struggled with the things that are sort of on our plate to do, right? To deal with. And so we listen to those people because they're like us, because they've been where we are, and we trust that their personal experience will, listening to that, will benefit us. And I think that that comes from a space of not trying to do harm, but to actually make the best decision that you possibly can make for you and your family when it comes to their, health and well-being. And so knowing that people listen to all different types of providers and all different types of peer communities, we need to be thoughtful about who we're engaging. And we need to be open to messengers whom we might not previously have thought about as trusted messengers, right? We need to engage with them. And then I also think related to that is we have to sort of not be afraid to lose control of the message, right? In my experience, messengers online don't want to harm the people that follow them, right? They don't want to harm their communities. That's not their objective. They are trying to give them all of the information that they have available to them. And I think that with that intention, we have to allow people to tell, even if it's not communicated 100% correctly, we have to allow them to tell the story of whatever the topic is we're focused on in a way that they find meaningful for their communities, for their audiences. That may not be how we want to tell it or how we would have told it, but I think that becomes incredibly important to like why we want to work with them. They know how to share that message. So I think it's a mix of format, a mix of messenger type, and an intention to try and be everywhere where people are getting their information. And there's a lot there. There's a lot to unpack. There are a lot of challenges with that, right? But I think that should be the goal.
I love the way that you frame those three touch points, because I think that Yes. Okay. Innovative formats, authenticity. That all makes sense. Kind of overstated, meeting people where they are, which is like this kind of concept of being everywhere, being in the niche conversations, right? That makes a lot of sense. And then this concept of the new messenger and broadening how, I guess, public health with capital P, capital H, like allows more or less people to get information or will like deign a group to get information from a certain other type of group or individual. Not being afraid to lose control of that message, like you said, like broadening it. I think that's so incredibly important to communicating in the era that we live in right now. I think that so much has worked in the past and worked really, really well. But it would be like, I don't know, bringing a VHS tape over for movie night. You just say, what? This is not how I receive, it's not how I watch movies anymore. And so, like, we all need to keep up with that. You can't bring it over and expect it to work. Right. So I think that I really like what you're saying. And I know that you have deep expertise, especially in, kind of the quote unquote influencer space, right? I think now I spent many years at YouTube. We call them creators. They call themselves creators. There are definitely now journalists online who don't want to be referred to as creators or influencers who are sharing information about public health or well-being. The well-being industry is on track to be $9 trillion by 2028 by many projections. And a lot of what we see as wellness kind of fits into health and health into wellness. So I'm kind of curious as you think about this creator economy that you're encouraging capital P, capital H, public health to get into, how do you make sure that maybe you don't, but how do you approach picking the influencer slash creator slash communicator slash journalist in that space to leverage? Or is it never up to us to pick? The public picks and we should just follow?
I think we have to be intentional, right? With anyone, even if you have huge budgets, has we have to make decisions on how those dollars are allocated, right? And so I think that having a strategy for whom you want to engage is pretty important, right? Both towards what you want to see happen, what your goals are, and how you use your resources effectively. And I think, one of the things that I think we need to be prioritizing is health conversations in non-health spaces, right? In non-health conversations. So making health part of other types of conversations, because that's what people are going to gravitate towards naturally. So being able to reach them in those content and conversation streams is a way to introduce new health information, or perhaps it's not new, but it's the latest or it's new to them. That's how you're going to actually introduce those new ideas into those communities that might not otherwise have heard that information. And so I think I will say the content does need to align to some extent, right? So I don't think you could ask somebody who is only writing about or talking about muscle cars to all of a sudden pivot and talk about a health issue, unless there's maybe a tie-in, right? I think certainly you could have a tie-in with somebody who's had a personal experience with a health issue, right? Maybe it's uh, high blood pressure or losing weight or physical activity and nutrition. It could be mental health. It could be um, any number of topics, arthritis, right? There could be so many different ways to connect somebody who doesn't talk about arthritis to talk about arthritis. And so I think looking at who's out there in the space, who's reaching the audiences that you want to reach, what is their content? The most important part of this becomes the relationship building, getting to know them, follow their content, and I don't necessarily mean invest here as like dollars, but invest time in getting
Mhm.
to understand what they're passionate about, how they respond in comments. Do they respond in comments? Do they have a newsletter or some other or a podcast? And so you're following them on multiple channels. You're listening to them regularly. and you're getting to know them, their voice, their tone. And I think that helps to craft and to come together with like their content and what you're trying to achieve. And one, see if there are synergies there that would make sense. Two, craft your strategy to outreach and start to build relationships with that person. And three, successfully get your message into those conversations. I think we need to think of health as part of our all of our everyday conversations if there's a place for it no matter what, I think. Um, but also lean into building these relationships, get to know these messengers. And I think that goes for online and off, right? It could mean that you want to work with a local community partner, or you want to work with a big brand, or you want to, with whomever you're talking about. This is not just show up and ask when you need something. This is about a mutually beneficial relationship that can take a lot of different forms. And I think can really achieve success if done correctly.
I really appreciate that. And that's in the context, I think, of proactive campaigns. What would you say about trending health topics like making your own sunscreen or, I don't know, like there's a protein thing happening right now in like the zeitgeist, right? Everybody's talking about protein, feels like suddenly. Oh,
Cottage cheese.
cottage cheese. Yeah, all of
It's
it.
having a
Like,
moment. Yeah.
yeah, yeah, everything. And so, what do you think the average public health officer, doctor, even like person from the system is missing when it comes to responding to trends? So not just building those long-term relationships you said, which you're recommending, which is so valuable and maybe valuable in this context as well, right? Because you then have somebody you can activate to come forward and talk about that trend from a space of those audience that might already follow them. But like, I guess, what do you think is missing right now from the public health voice when it comes to these like online kind of wellness trends? And they're not always bad trends, I should say.
No. So, I think that there's a difference between a viral trend that's happening online and um, a health crisis that might be occurring. And not every trend is a crisis, but sometimes those things might be the same thing.
Hmm.
I would say, you know, there's no need to run down every trend, right? We just don't have the time nor the bandwidth, nor is every single trend going to be incredibly important to be a part of. I think if it aligns with what you want to achieve, then certainly figuring out how to tap into those trends with your message can be incredibly effective, right? It's sort of a lever you can pull to get a message to have some visibility that might otherwise not have the same kind of visibility. I would say, though, it goes to your first point, which is that if you just show up and you don't have the relationships built, I mean, I guess you can pay to have your message integrated. Um, but it may be that that's not going to work for that messenger, or it could just be that that person may not be very interested in working with you. So I think showing up early, developing a cadre of voices from all different perspectives that can be leveraged at times of crises, or can be kind of moved to amplify a topic when it's trending. I think that that's sort of the long-term strategy, right? We need to be in this for the long game. I think most public health people would say that they are. And certainly there's a lot going on in the health space that, it can be hard to sort of look that far ahead. But I think if we have the intention of building those relationships for the long haul, then it makes it easier to kind of go back and say, you know, I noticed you did this thing. Could we follow that up with a piece on X because it aligns with those things, right? You can start to have the strategy of integrating what you're working on into those other conversations. But I do think that doing that one off can be successful, but sometimes it won't be successful.
Yeah. And so I have two questions actually that popped into my head from there. So I'm thinking about the concept of like a paid partnership that you mentioned. And I'm curious if you have any research that you've done on the efficacy of a paid partnership with a influencer voice or a non-traditional public health messenger. So that's like my first question. And then my second question was thinking about building these narratives together with the relationships you might already have. So like I was thinking about, I think it might be Alcohol Awareness Month. And like I recently quit drinking and I was thinking about like it would be so cool for like all of the influence out there who have non-alcoholic beverage lanes that they either promote or own themselves, celebrities, all of this, to like get in on a big campaign with whoever is in charge of the Alcohol Awareness Month National Committee. I don't know if there is a national committee. Uh, like that seems to me like a natural integration where you wouldn't need to pay for it. So I guess that there's kind of two questions in that concept of like pay for play and like influencer motivation to work on a campaign or otherwise. Just what do you think about
Yeah. Yeah. I mean, I would say that, I've been in the space for 20 years before we called them influencers, before we called them content creators,
what did they used
before
to be called?
we called it organic marketing back in the day. So, yeah. So, before I did this for health, I did this with brands. And back then, and for many years into my working with influencers for health, we didn't pay. We actually went out and we asked them if they would support any kind of initiative I was working on for free. And I would say a lot of the time we were able to be successful with that in those early days. The space has shifted. It is much more monetized. You just rattled off, an industry uh, valuation benchmark, right? A lot of brands are investing a lot of money with influencers, which just makes getting their attention harder, especially if you're not going to be able to pay them. I would say that in my research, we have paid influencers and we pay them because they're research participants, and research participants usually get an incentive for their time. And my research has shown that exposure to influencer messaging by their own followers. So again, we designed these studies on a couple of different topics to measure the effects of an influencer's message on his or her own followers. So not just the broad general public, but again, the people that follow and trust that influencer. And we've seen statistically significant positive increases in knowledge, attitudes, beliefs, and intentions for behaviors related to immunization, reducing one's risk for breast cancer exposure, and some other topics as well. So I think that there is an expectation of payment in the industry. I think that to get attention and to pull the lever on timing, like when you want that message to go out, paying influencers is not only expected, but it is the best way to guarantee your messages go out when and where you want them to go out. In terms of pro bono support or, kind of goodwill support, I am a believer that that still exists. And I do believe that people care enough about certain issues that they're willing to donate space on their social profile or audio platform, or you name it, video platform, to shed light on something that is really important to them. I think it is incredibly important as health communicators and public health professionals that you cherry pick those opportunities, right? That you look for those moments and those issues and those messages that are throw down that emotional, kind of currency card when it is really important, and figure out how to wrap around that ask with other opportunities to either amplify what they're doing through your own handles, right? Give them visibility. And or again, as part of a longer term relationship, there are other things you're bringing to them that support their business, right? Because these are all content creators, influencers, they are brands. They have their own management teams, and so these are businesses for these people. And so they're while I think it is an expectation, it is also a support of their income and their livelihoods, and in addition to that. So, and a recognition of the influence that they wield with their communities. So, I think it can be done. I think it should be done with some forethought and planning and strategy, and as part of hopefully a longer term relationship that you're aiming to.
Or just DM somebody in a panic saying, right, you need some help with something. That makes sense. But I think too, like, if you go back to the Alcohol Awareness Month thing or concept, like, if those influencers have a brand that they're either already actively paid to promote or that they're promoting themselves because they own it, like, you are offering them an opportunity for a different type of content around the content that they might already be producing. So it could be smart to think about different ways that your campaign or otherwise, if you can't pay them, could be a value add to them. So find the influencers that are already I've already be talking about these things, and perhaps it's just an interesting hot take for them to do a cross promotion or cross partnership with a public health agency or otherwise for something that is related to their area. So like if they're a surfer, something about water safety or otherwise, like coming into the summer, or again, like not making your own sunscreen.
Yeah.
So
But
maybe they could have an interest in that from a content perspective.
yeah, and I think to your point about being brands, this goes back to what I said at the very beginning, which is like there really is an intention not to do harm here, right? Like they are trying to maintain and preserve their own reputation with their followers. If they start sharing information out that could be harmful or perceived in some way negatively, they're going to shy away from that. And that could work for us. That could also work against certain health topics, right? That are just they don't want to engage in sort of more taboo subjects, let's just say. So I think it isn't, their respect for maintaining their following and their own reputation can really benefit us in the sense that like we can trust them to message what we're working on in a way that is meaningful to their audiences. And even in some cases, this has been my own personal experience. They either want you to make sure that their message is done correctly, right? So I never ask content creators for review of their content. Oftentimes they will ask, can you just make sure I got this right? Right? They don't want to put out bad content. Or if they put it out and it's wrong, there's often usually a way to go back and just make sure that they know that, what, this isn't actually accurate, and, either maybe do a follow up or, do something to sort of clarify. And I've seen the case many times where they're willing to do that. If done respectfully and in partnership, I think it's a really effective strategy to get quality, accurate health information out there.
Note of like controversial topics that might be a bit taboo that people don't necessarily want to touch. How would you recommend kind of like, do you have any strategies for breaking down that controversial information into appropriate touch points for different types of communities that influencers might reach, or like different ways that their communities might understand it without feeling overwhelmed or attacked? Have there been any strategies that have emerged from your research or your experience that you want to highlight?
So I think it's a dialogue. I think it is, there are some people who will just say, no, I don't want to touch a certain topic right now. There are other people who are willing to talk about different types of health topics, but you sort of have to figure out what they're comfortable with. A lot of these creators and influencers have multiple platforms. There might be one particular platform that they would prefer sharing on, and you have to be open to that. It could be that they do it in the form of an interview. So making expert people available for question and answers and allowing for them to sort of dictate what piece of the message or how they want to contextualize the message is really, really important, right? So there's a lot of data around the value of mixing narrative storytelling and didactic information, and how effective that can be in terms of people's knowledge about a topic, their awareness, their intentions for behaviors, and even sometimes behavior change. And I think that's the power of these content creators. They merge data and facts with personal stories, and they do it in a way that I think can be quite powerful, but leaving that part of how you mix those two and what the framing is up to the influencer is really important to allow them to both maintain and sort of reinforce their brand, to allow them to share your message in a way that will feel very comfortable for them and their followers. And I think to get the message out there, which is the most important part of this, right? If we want to control how they say things, we risk not getting the message out there at all. And so, yeah, I think it's really listening, and it's really being open to a content creator or another type of messenger telling you, this is how I would frame this. This is how I would message this. This is what I'm comfortable with. And also just knowing that some people are going to say no and being okay with that too.
That, like, I guess regardless of whether it's shared from an influencer or a doctor or just like you said earlier, like a peer, what is that hook that gets somebody to change or to make the choice that you're trying to encourage them to make versus just hearing about it, seeing it, reading it, watching a reel and moving on? Like, what's the oomph that gets to that behavior or intention for behavior change that, we're all just dying to be able to figure out? Do you have the key?
And I really, that's the $1 million question, right? Um, I, I think it's really important to remember that health decision making is very complex, right? And it depends on the health topic. If this is a chronic disease that requires, maintenance over the long period of time, those are different issues than asking somebody to do something one time. It also is very complicated when we talk about things like substance abuse or addiction, right? We're dealing with all different levels of health issues when it comes to some of those topics. So I think one, it's not as simple as like, here are all the health issues and here's your answer, right? Here's the thing to do to get people to live healthier lives. I also think we're faced with a lot of challenges in terms of like access to healthcare, un and underinsured people. So there's just a lot of structural issues around health behaviors, right? That influence people's individual choices. And I also think it's important to recognize that there's not one message to rule them all, right? From a communication standpoint, I think communications has an incredibly important role to play in health behavior change, but it's not the only thing, right? All of these things have to work together. And behavior change is long term. And there's lots of theories around this, and I won't go into all the details on the theories because they all sort of look at different aspects of human behavior and psychology. But we have to look and take a long view when it comes to health, right? And we have to understand that there are all these different kind of midway points that we should be looking at as measures of success of getting us towards living healthier lives. And so, as communicators, planning for those things up front, recognizing that communication is not the only lever that we need to pull when it comes to health behavior change, but that it's an important lever to pull, I think become all of those things need to be considered as we're planning our intervention up front. And I think as it relates to different topics have different kind of considerations. One of the things I would just make sure that people understand is the value of talking to the communities and audience groups themselves, right? Hear from them. What do they want? We in health, we serve people. That is what we should be doing. We're not here to say, you know, you're doing everything wrong. We're just trying to make sure you know what all of the right, all the accurate information is, and hopefully help people live better lives. But we're here in a position of service. So I might think I know what video to create or what message is going to resonate, but it's the communities that need to tell us. They need to tell us what they want to do, like whom we should work with, what messages are important to them. And then we as communicators can go figure out, let's create some things, let's test them, and then let's disseminate them through a variety of channels. But talk to people because they're going to help us figure out what those hooks are.
Talk to people. I love that. That could be the name of this episode. Just talk to people. Thank you. And so I guess my last question then, we talked a lot about, kind of where you see health communications going, but in, 20-year career of getting to these places and doing the research and writing books on it, like in 10 years, we're to fast forward in your dream scenario, how are we communicating health to the public? And how should that or could that shape decisions public health people are making now?
Yeah, so I hope that the next 10 years brings about a reimagining of health communication, of what we can be doing better. I would love for us in 10 years to be talking simply about health information, sharing quality evidence-based information, but doing so with compassion and empathy for people who are trying to make some tough decisions for them and for them and for their families. And my big hope is that we're using AI to scale this. And you know my work, and we're aligned on this, right? Like
Yes.
our circles have crossed here. I've been working on a project, on an initiative called Health Communication AI. And I do believe that AI holds one of the keys to our future for the field. I think the tenets of quality information shared simply and empathetically hold no matter what tech you're talking about. But I think the opportunities that Gen AI have for doing that kind of work are pretty powerful and can allow us to scale like we've never been able to scale. So we currently just don't have the capacity to answer all the questions that are out there. But I think AI built correctly with, quality data ingestion and annotation, and with a frame of empathy and compassion for people, I think can really help us achieve something that we've never achieved before. And I think 10 years is very doable.
Yes, I agree wholeheartedly. I couldn't agree more. Thank you so much for talking with me today. Thank you for being here.
Thank you. Thank you, Brinley. I'm so happy to be part of this. Yeah, I'm just excited that you're doing this incredible podcast and talking to all these different people and scientists and sharing information out. So thanks for having me on.
Thank you for coming on. We will talk again soon. That's it for today's episode of the Science to People podcast. A huge thanks to Dr. Amelia Burke-Garcia for sharing her insights and helping us see how modern and effective public health communication can evolve to really meet the moment. If you enjoyed this conversation, make sure to subscribe and share it with somebody who might benefit. And if you're working to make science more accessible, we'd love to hear from you. Thanks for listening.